Longevity Plus would like to thank you for joining our webinar today. Our host, Dr. Gordon, is an expert on nutrition, mineral metabolism, and anti-aging. Dr. Gordon is a consultant to Longevity Plus, where he is responsible for designing effective, natural supplements that help to support optimal health. Today, Dr. Gordon will be discussing the benefits of iodine. Without further ado, please join me in welcoming Dr. Gary Gordon.
Welcome, everyone. Today we have a topic that has only come to the foreground in the last few years, and that is iodine. And iodine, like many minerals, makes a huge difference in how long and how well you live. So, if we understand that everybody, for example, would be anxious to take calcium, but I teach them never take calcium without equal amounts of magnesium. And many people are aware that chromium can improve sugar metabolism. And we all know that some people need iron and others may be harmed by it because there's a disease called hemochromatosis where some people can't get rid of iron. So when we start talking about trace minerals, those that we all benefit from and virtually none of us have enough of would include things like selenium, because it actually helps you handle your overload of mercury in your body. And magnesium is not adequate in 99% of people when tested properly with intracellular testing. And so iodine has been around for a long time, but it's now very important for you to understand that we all need more iodine. And today the United States government has released their new recommendations for the dietary recommendations, and they're telling people avoid salt like the plague. Now, could that be one more time that government shoots itself in the foot and gives you the wrong advice? Well, you decide for yourself when we get to the end of this, but I will tell you now that salt may be one of the only way people are getting iodine, and when you learn how important iodine is, then you may become aware that you want to get it even if you have to buy it separately, which I will recommend most people will need to do. We need it. It's essential in every part of our body. Your white cells won't fight infection unless they have enough, and your thyroid will definitely not work optimally. And how many people in the United States today are fighting suboptimal thyroid function? Well, that number will be in the eye of the viewer, but from my consideration, the number will be around 80+% of people would be healthier if you could optimize their thyroid function. And since they make it very difficult for doctors, unless they're extremely knowledgeable, to give you the thyroid that makes me feel good and lets my patients feel good and stay healthy year after year, then you may wind up having to do the best you can by supporting your thyroid function by making sure you have optimal levels of iodine. And it is known that I came from Madison, Wisconsin. It was the goiter belt. So the most famous clinic in town specialized in removing these goiters. And they never told anybody when they took the goiter out that you need to get on iodized salt. They didn't bother to mention, because I think they liked the business of taking your kids' huge swollen thyroid glands out, because we were in the goiter belt. But most of the country today, in my view, is in a goiter belt. That means you're lacking it because there's an increased need for it. Now, this book is a book that can help you learn more. And even though it's added to the salt supply, it still is not adequate to meet our needs today. Now, where are we going to get this iodine? Well, we can get it out of eating foods And you can see these are microgram quantities in all these foods. But what's going to shock you is I'm going to tell you that my recommended dose for people is milligrams. So you just need to have 100 pieces, 100 servings of shrimp to get up to 35 grams. And that's going to mean that, 35 milligrams. So that means that no one is really in their diet actually getting what I'm recommending today. We're deficient in our soil. Of course, that's true for all essential trace elements, which is one reason that the Beyond Any multiple, which I designed, which is the multiple that I give everyone if you don't happen to buy Beyond Chelation Improved, to get the 9 pills so that you have the full benefit of a primrose oil and an omega-3 and the oral chelator called Essential Daily Defense and the phosphatidylserine ginkgo. If you buy BAM, Beyond Any multiple by itself, you will be receiving all of the trace elements from the Great Salt Lake. But they will be in trace amounts, whether you talk cesium, rubidium, gold, or silver. They're going to be in small amounts. And so we want you to know that there are foods that are interfering with how well our body can utilize the iodine. And broccoli and Brussels sprouts are the best possible food today to fight against the epidemic of some of the